Right. So, a couple of years ago, I went to the emergency room, and I had to go because for the first time, I didn't realize what was going on, and it had struck me when my cousin and my aunt and uncle and mom told me that my ankles were getting swollen and my legs were getting swollen. And, it was very, very disturbing because I guess when you're with yourself and you don't see certain people for a long period of time, when they see you for the first time, they can tell very quickly whether or not you've gained or lost a significant amount of weight. So they saw my calves and they saw my ankles and they realized that they were all kind of on the swollen side. And nobody seemed to know what it was at the time. So we decided that I was going to go to the emergency room. Now, this was a couple of years ago. Here's one of the bad things that happened at the time. I was unemployed and I did not have COBRA or medical insurance at the moment. But I knew that I had to get the whole thing checked out. And I went to the hospital and they gave me a dosage of Lasix, which of course is like a water pill, and it's supposed to cause you to go to the bathroom multiple times after you take it, and it certainly did do that. And it would also, it's a type of medication that's used for high blood pressure or somebody who has congestive heart failure and has water developing around their heart, things of that nature. Exactly, Pickle Panda. Not drinking enough water, things of that nature, or too much water. So as it ultimately turned out, there was too much water. But here's the reason I'm telling this story. Not because of my health condition, which I'm now working on in different ways. But in the 2 hours that I spent in the emergency room, I had one dosage of Lasix, 40 milligrams, and I had one chest x-ray taken, and I had one 30 seconds under the CT scan to check my chest and my heart to make sure I didn't have congestive heart failure. Luckily, all of that was negative. There's another reason why the excess water is there. I'm not going to get into that now. But because I did not have medical insurance, that 2 hour experience in the emergency room in Red Bank, New Jersey, cost me $17,500. Wow, Pickle Panda, you were just double the amount. Yeah, look at that. You were two. You caused me to have two visits with your $35,000 bill, but I probably should have waited. I didn't look at the chat room right away to see what the bill to see that you guys wanted to guess what the chat room what the cost was. I'm sorry about that, but $17,500 for about 2 hours in the emergency room. Now, here's what I'm going to say. I'm not trying to make anybody feel sorry for me because at that point in time I didn't have insurance. I was out of work. Understand, this does happen. Okay. But here's the point that I'm trying to make. $17,500 in a bill for a person who is not working and who has a medical condition is just unaffordable, obviously. I mean, there's no ifs, ands, or buts about it. A $17,500 bill for somebody who is working and working in a very high-paying job is still quite an excessive amount of money to pay. But it's a reality. Medical costs are very expensive. The equipment that they use and that they buy that are top of the line, state-of-the-art pieces of equipment are extremely expensive to buy, and as such are therefore expensive to use for the patients who need them the most. And so, it becomes a very difficult situation. What I didn't understand was how the one dosage of Lasix that I got, which would probably cost about 35 cents at a pharmacy with a generic prescription, cost $40. I suppose that when you go, the prices are extremely, extremely modified and jacked up to a point where they become unaffordable for somebody who doesn't have medical insurance. Okay? So here's my bottom line to all of this. And my bottom line to all the things that went on over the last 14 months. This is the first day and probably the next to last time you will hear me talking about this healthcare slash health insurance debate on this show. $17,500, fine. What I would hope is that people who don't get the whole situation with the healthcare debate, or people who are against the whole healthcare reform that's been going on, would understand there is one thing that was necessary out of this whole chaos that has ensued over the last couple of weeks, and especially the last couple of nights where there has been super debate. And that is that no human being should have to worry about getting a $17,500 bill for 2 hours worth of work in a hospital. Now, why is the $17,500 so? Why is the fee that much money? Because there are people like me at that point in time who went without insurance, and there are other people who will go in without insurance and who will never, ever wind up paying the $17,500 that they're charged for getting a CT scan, a dose of Lasix, and a chest x-ray. They will never see that money in these hospitals. They never will see that money because people will just blow it off. They will take the hit on their credit report and say, to fuck with it. If I have to go back again, even if I don't pay it, they're still going to have to take me, and they're still going to have to give me some care. And so the one thing I just hope and pray that people understand that will come as a benefit from what is happening with President Obama's health care. Think of it what you want. I still don't know what I think of it because it's too long and I don't know enough about it. But what I do know is that this time tomorrow, there will only be 5% of the American population uninsured.